I'm Jim Parrish, CEO of Humboldt General Hospital in Winnemucca, Nevada. I've been here for 9 years. We're a small critical access facility. We're licensed at 22 beds. We have 30 long-term care beds. And we are 172 miles from tertiary care, 172 miles from basically the closest hospital. We are a very old hospital. We've been in existence continuously for 128 years, serving this community, a small community of 8,000 in population. The county is 17,000 in population. Any small hospital has to decide whether they're going to try to grow and keep patients or they're going to shrink and eventually get out of the acute care business. Being 172 miles away from a tertiary care facility, we didn't want to shrink, we wanted to grow. And that meant keeping patients locally rather than transferring them. So our hospitals program has been tremendous in keeping patients local, which is good for the hospitals, good for the community, it's good for the patient families. Financially, we have improved our acute care income, if you will, dramatically. We've gone from about 2 patients a day to an average of 8 patients a day, which doesn't seem like a lot, but for a critical access hospital it is a lot. We've had great outcomes. As I said, financially, we have done very well. Educationally, the interaction between the hospitalists and the nursing staff has been tremendous. We have a tendency here to hire new graduates out of nursing programs, and it's difficult to get them up to speed, but with the help of our hospitalists being here 24 hours a day, we've been able to bring new grad nurses along and place them in the ICU. It's allowed us to move from an okay hospital to one that we've increased our quality. We have improved our relationship between the nurses and the physicians. Our full-time physicians are much happier because they're not taking call and trying to take care of inpatients as well as do their office work. And the relationship between the full-time physicians and RPG has been very good. So our quality is up, our morale is up. Financially, we've been named in the top 25 hospitals by Modern Healthcare in 2012. In 2013, the top 20 critical access hospitals by the National Rural Health Association. So that's what we're trying to accomplish with the hospitals program as well as the surgicalist program, which is a new program for us. We've been doing that for about 8 months. We did it in response to a real lack of service in our general surgery area. We added general surgery through a rural physicians group. They have 2 surgeons that rotate every 2 weeks in this community to serve our community. What we have from the surgicalist program is high quality of care, extremely responsive to ER calls as well as calls from the acute care area. Tremendous benefit to the community in that we now have surgeons here that can make an impact on people's lives, can save lives, and when you're 172 miles away from a tertiary care facility, that is tremendous benefit to your community.